Our diabetes prevention program is 12 months long. That consists of one dietitian and 30 participants video conferencing on Zoom 26 times in a year for 1 hour. We use Zoom because we feel like it most closely replicates an in-person class, which is what all of the diabetes prevention research was based on that Medicare funded. And we've noticed that by using live group video conferencing to address chronic diseases like prediabetes, for example, it really builds a sense of community and friendship amongst the participants that helps to drive behavior change because it makes it feel like you're in a classroom with other people, just like in a physical classroom. We've enrolled more than 20,000 participants into our diabetes prevention program now, and we've been enrolling between 2,000 and 3,000 people per month recently. We've had great success by achieving full recognition with the CDC. The CDC actually grades diabetes prevention program outcomes, and full recognition is the highest outcomes rating that you can be awarded. It means that you're consistently delivering results like 5% average weight loss for people that participate for 9 months. We have other statistics we've looked at, like 1 out of 3 people that attend at least one class and enrolled a year ago have been losing 5% of their weight. Close to half of people that have good adherence, which means they attend 60% of the classes, are losing 5% of their weight. And many people lose a lot more weight than that. We've had people lose 10 to 15% of their weight and even come off of medications like metformin, hypertension medication, lipid medication. And so it really helps to assist people with making these large improvements to their health where they can even come off of medication in certain cases. "12 months ago, we started expanding into this larger suite of telemedicine services. And right now, one of our big initiatives is to expand into virtual primary care. So imagine if you had a physician that was doing virtual primary care full-time with a panel of patients, and they could do things like an annual wellness exam where they talk to the patient about their health status and make a plan to address their chronic conditions. That physician could also order lab tests, either an at-home test or maybe an A1C test, a Quest Diagnostics. And then based on that lab test, they might recommend that they enroll into a diabetes prevention program like Fruit Street, for example. It will also include prescriptions that the physician can write that could even be delivered to the patient's home. And we really see that virtual primary care doctor being almost like a hub for the patient where they could actually refer them into multiple chronic disease management programs that Fruit Street's developing. For example, we're expanding into a program for type 2 diabetes, where again, it would be using group video conferencing and a certified diabetes educator. We're planning to develop a program for hypertension, where patients again would be in groups working on their diet and lifestyle, but they would have a cellular blood pressure cuff at home. Also, we think groups can be used for mental health as well as smoking cessation. And again, it's because these group classes really build a sense of friendship and community amongst the participants that drives their behavior change. But by having a physician and a behavioral health layer on top of it, it brings that clinical component to all of this. And so ultimately, this will become almost like a multidisciplinary virtual clinic that also has chronic disease management programs. And that would allow us to provide a higher quality of care to the patient by having all these services in one place. We even think about things like if someone's in a diabetes prevention program and they're not losing weight and they can't sleep, maybe it's because they have undiagnosed sleep apnea and they need an at-home sleep study, and we discover that they need a CPAP machine. And that CPAP machine actually helps them to get some energy back during the day, make the correct eating decisions to the point where they may even lose enough weight to not need that CPAP machine anymore and reverse their sleep apnea condition. And so those are the types of use cases that we think about as we expand into a multidisciplinary suite of telemedicine services. I think that our new product direction will really start to set ourselves apart as well. There's certainly other companies that have taken that multidisciplinary approach, but I don't think they've used live group video conferencing to the extent that they potentially could. I think that the pandemic's really created almost like this rapid adoption of Zoom, where now we can really use that cultural shift in using Zoom more so than the past to address these chronic conditions. And so I think that's one of the unique differentiators, is using group video conferencing to address chronic diseases. And then also our funding model is very unique. We have over 500 physicians that have invested more than $20 million into the company that serve as advisors and make sure that we're building programs that really have evidence behind them. So I think the combination of being owned by physicians, but also taking this unique approach to chronic diseases through group video conferencing brings something unique to the market. We're hoping to hit between $6 and $8 million of revenue this year. And then I'm the type of entrepreneur that at this stage of a company really likes to focus on the next 12 months. But I would say that if we're successful in hitting our goal for this year to hit between $6 and $8 million of revenue, then we would certainly expect to drive more than $10 million of revenue next year. And our revenue has actually been tripling or quadrupling every year since the 2018 to 2019 jump. And that's because we've started focusing in 2018 on selling these telemedicine services to self-insured employers and health plans. If you get one employer customer, you can sometimes generate $1 million of revenue from that customer. If you get one health plan customer, you could earn $3 to $5 million of revenue from one customer. And so by building up a book of business that has several dozen self-insured employers and health plans, you can see how a digital health company would get to $25 or $50 million in revenue pretty quickly if they have a good product. And so that's been our business strategy, going after those self-insured employers and health plans and building high quality products that drive outcomes.